that there is also the psychological element, right? So a lot of times when we think about oppression, we tend to think about actions that must be done onto somebody, but what if there's more just subtle mistreatments of people that affect their psychological or their internal ideologies about themselves or about others, right? And on this page, what I love, and if you use it, quote me, because I've never seen anybody else do this, but so the graphic here, in public health, a lot of the times we're worried about outcomes, right? We're worried about those downstream activities, you know, if people have hypertension, if people have diabetes, and how we're going to alleviate that. Now we're looking more towards the upstream, right? So how does where people work, pray, eat, sleep, and live affect their life outcomes? But I argue that we should be instead focusing on structural determinants of health, right? So systems, because there are systems and policies in place that directly hinder people's ability to have healthy lives, right? And so that's what we're talking about today. We're going to talk about systems and structures and how those are in fact what we need to work towards fixing to even start to chip away at outcomes or making where people live, work, eat, sleep, and play healthier. So this is my definition of power. It's not in Webster's dictionary, so feel free to push back if you want. But when I talk about power, I mean the ability to change, define, manipulate, and control. I also would like to throw value, right, on that definition as well. So add value, place value on others. Inclusion is a sense of belonging, which allows people to engage and contribute within an environment. In public health, we really look at inclusion as, okay, I had this community forum, so the community was included because they could come to the community forum. This definition challenges that when it says that it allows people to engage and contribute, right? So we need to have spaces that people feel comfortable contributing and utilizing, not just have a space. And then critical consciousness is what we'll be talking about today, the critical consciousness theory, which is the ability to critically analyze systems of oppression to better understand the ways in which they shape our reality. Okay. So what we're going to do is analyze systems of oppression by using the critical consciousness theory. And what I want to start off doing is talking about the theory. So the theory, the critical consciousness theory, yes, raise the roof, was created by Paulo Freire. And he explained the critical consciousness theory in his work, The Pedagogy of the Oppressed. His work really focused on Marxism and looked at the class divides that existed within Brazil. He was an educator at the time, and at the time in Brazil, you had to pass a literacy test to be able to vote, much like the literacy test that we had here in America. And what he noticed was that the people that couldn't pass the literacy test, therefore the people that were barred from voting, were usually the people that, you know, were low wage earners. And so he saw that there was a real connection and a real kind of system or undercurrent at work there, right? It's not by mistake that the people who are most impacted by policies are also the same people who have no power to vote or change that system, right? And so his work also ties closely with Frantz Fanon's work, Wretched of the Earth, which was another kind of Marxist approach to how he viewed the Algerian society, because Frantz Fanon was Algerian. And so the big takeaway from Fanon is the power of language, right? The power of revolution and the role of the intellectual, which also comes into The Pedagogy of the Oppressed by Freire. And so the role of the intellectuals, the folks that have the knowledge, right, that have institutional knowledge, right, because we know that communities and people that do not attend college also have knowledge, but intellectuals understand the systems in a different way. We have a different relationship with systems. And so it is our job then to not only understand the systems, but we also need to relate that information back to our community members that don't have the same privilege, right? So that they can better understand themselves or the roles, how the systems affect them. So the major themes from the pedagogy of the oppressed is the rejection of the banking approach. So the banking approach, for terms of us talking about community engagement and health equity, is that, you know, communities are empty vessels and us public health folks need to go in and fill the community with knowledge because they don't have any, right? And so this is a complete rejection of that. Instead, it was the view that communities do have knowledge, so do practitioners, and together we can work to create solutions. So he's really focused on that gray space. So there's no such thing as an empty vessel. Everyone has knowledge, but what we need to do is share the knowledge that we all have with each other. And this would lead to the co-creation of knowledge. And then another thing that was talked about by Paulo is that systems of oppression are reinforced and reproduced. This means that the systems that we are going to talk about later on in this presentation are not just there for no reason, right? That there are actually people that uphold these systems. And it's like this cyclical thing. So the systems uphold certain people, give certain people power and privilege, and those people with power and privilege uphold the system, right? And so that's not by accident. Another theme is what Paulo wanted us to do was move away from mimicry and opposition-only stances. So is there anyone that can give me an example of either moving away from mimicry, like how do we see ourselves in public health or just in general mimicking other systems, or taking opposition-only stances? I'm like, I love not talking. My jaw's sore, so we can do this. Okay, this is the one bailout. Everybody gets one. This is all you all's one. So in terms of mimicry, right, it's that one size fits all. So I've done X in this community, and so I know that if I transfer it to community B, it's gonna work perfectly too, right? And we know that that is not true. There's not a one size fits all solution. And then opposition only is simply like, well, if we want people to not like, almost like abstinence only education, right? Like we don't want people to have sex, so what we're gonna do is just tell everybody no sex. We know that that might not be the best approach, right? And so we don't want to take just in opposition to what it is that we feel like is an issue. We wanna look at that gray space, again, allowing for more solutions to occur. And then Paulo also urged everyone to be critical of the oppressive structures. So can anyone, before I move on, list any structures, right? When we talked about the definition of oppression, really structures that have the power over, right, or power to control individuals. Can anyone list or name any structures? Does anyone have a clue, I guess? as much time as you need. List them all. Oh.
So any type of predominantly white institutions in higher education, K-12 systems, those are large system structures that impact students of color historically. And so I think those are two examples.
Perfect. Yeah, thank you. Do we have any example? Oh, okay.
As far as large structures go, I mean, health insurance is a perfect example for sure. And access to like special education services, I think, is impacted through the public school system, that impacts a large number of people and their access to services.
Yeah, thank you. And a few others are like our government, right? So we look at policies, laws, politicians, criminal justice system, right, will be another large structure that's kind of thrown in there with the government as well. And so his argument was that if we understand these structures, the more structures and systems that we can kind of name and understand, it'll help us understand how we interact with those systems, right? We can really critically analyze those systems, but only when we know what they are. And then it also takes the fault off of the individual. When you're able to learn or understand that there's these larger systems at play, you kind of start to see that it's not necessarily your fault that all of this is happening. Instead, he puts the onus on the individual to then do something. Once you learn about the systems and you know how they operate, then you need to act to actively dismantle them, right? All right. And so this is my favorite quote in the book, right? So freedom is acquired by conquest, not by gift. It must be pursued constantly and responsibly. Freedom is not an ideal located outside of man, nor is it an idea which becomes myth. It is rather the indispensable condition for the quest of human completion, right? And so because we're all a collective and we're all in this learning together, does anyone want to take a try at breaking down this quote, or either something that sticks out to you? Talk about something that sticks out to you in the quote. How about our online folks? Anybody online? See, if they're like me, they get on a webinar and they're not on the webinar. Yeah. Thank you.
I think that for me, I have always really valued this quote, because a lot of times when you talk to people, they're like, oh, well, it should just happen, right? Or like, I'm just going to, like, if I talk about it, it'll happen. And that's not what it is. Like, nothing changes until you change. And so that's really what the quote meant to me, is like, if I want to be free from something, if I don't want to have that, then there's something that I need to do. The onus is on me.
Yeah.
And that's kind of always what this quote meant to me, that it can be a reality, but you have to do the work. Nobody's doing the work for you.
Yeah, thank you. That's perfect. Okay, so what I think, so I love that interpretation, and I 100% agree with it, right? And what I love to point out about this quote is that Paulo says, freedom is acquired by conquest, right? It's not a gift. And there was no definition, or there was no signifier, right, that only the oppressed need to work for freedom, right? So inherent in that first sentence is that we all are not free. Whether you are the oppressor or the people that uphold the system in some way, or the people that are being held down by the system, right? Neither of us are free. And that it has to be, it's a conquest. No one's gonna go out and give it to you, right? You have to work hard for it, or you have to kind of fight for it. And it is not this ideal that's located outside of yourself, right? So you also need to be free internally. You need to be conscious to all these structures, right? And then nor is it a myth, right? So it's not something that we can never attain. Like, we can attain freedom. It just takes a lot of work. And that no human is really actually complete or whole until they attain freedom, right? Yeah. Nope.
Paul Freery's been talking about that for a long time.
Like, it's around.
So you need it.
Oh, yes. No.
I can say it again. This, I think, is always really powerful, because when people nowadays, in the last couple of years, it's become a really big deal to talk about the internalization of oppression and racism and things like that. And everybody thinks this is a new concept, and it's not, because obviously Paulo Freire's been talking about this for a really long time. So
yeah, thank you. Okay, so with all that being said, how do these systems then, or how does this theory relate to the work that we do or what we study currently? We're gonna have a conversation, so. Yes.
Will it help if everybody, since we're a small group, ask where we're from and what work we're in, and maybe that can help discuss?
Yeah, I think we have time for that.
I don't know. It's okay. I just don't know where everyone. Are we all from medical campus or?
Yeah, we can.
I don't know.
I think that's okay. Yeah, why not?
So I'm Rene Gonzalez, and I work for Colorado Access. We support the state's Medicaid population in Denver. Well, the counties of Denver, Douglas, Adams, Arapahoe, and Albert. And so my personal interest is I've recently completed my PhD, and I used a lot of critical race theory in my research. And so this was really exciting to be a part of. So be happy to have this health perspective on what we're trying to do in terms of health equity work with Colorado Access and with our members, and making sure we address some of the health disparities and discrepancies that we see at the county level, at the individual level, at the member level, and how we can really focus on upstream health equity work. So for me, I think it relates significant because a lot of our members are impacted by these health barriers and they're unable to achieve positive health outcomes. And so what we're trying to do is figure out these barriers that exist and try to figure out a way to connect with our members and make sure we can have them become successful in terms of self-sufficiency or reduce that cycle of poverty they're experiencing. So different ways that impact a lot of our members. So that's kind of where I'm focusing this and why I'm here.
Yeah, thank you. Anybody else want to share how this relates to the work that they do? And
this is Vicki with TriCounty Health Department. I am one of the nurse managers that works with the MCH block grant.
Did we say this is Vicki?
Yes.
Hi, Vicki.
Hello, how are you? That's good. So yeah, this totally relates because we are integrating health equity into not even just the MCH priority areas that we're working on, including infant mortality, maternal mental health, everything from even medical home to developmental screening. So we're trying to integrate health equity into how we do our business of our health, of our priority areas, but it's also really relevant for Tri-County as an agency as we look at how do we work as a public health department with a health equity lens and trying to, really, I think echoing what the previous speaker just said, really meet our clients or our county residents where they are. And so it's very relevant. And the more that we can learn about how do we integrate it into our work, the better. So that's why I'm here.
Thank you.
Sure.
Hi, my name is Karen Wolf, and I currently work at Clayton Early Learning. So it's a early Head Start and Head Start education program. And before that, I also worked pretty extensively in mental health. I do mental health consultation there as well. And so in the mental health field, it's all about how do we best figure out how to provide services in a way that meets the really individual needs of each family and each child. And is digestible, and accessible for them where they're at in life, because that's not always the case. Service provision is not always, it's kind of a one size fits all sometimes. And we're working really hard to change sort of that aspect of it.
Thank you.
I'm Rachel Schiff, and I currently work at Clayton Early Learning as the early intervention specialist. So I deal with all of our kiddos with IFSBs, and I consult with our kiddos that have IEPs. And I think that this really relates because most of the families that we service at Clayton, the services that they get look very different than the services that I saw provided when I worked at other schools like the lab school at DU, or when I worked in like different zip codes.
Mm-hmm.
The experience is different. The service coordination looks different. Parents' understanding looks different because it goes back again to that the intellectuals understand the system, and so then they know how to work within the system and make the system work for them, and which is one of the premises that Fieri had. So it gives automatic advantage in life. And so I really see that this relates because I feel like my job now currently is to actually work with our parents to help them sort of digest and understand the system so that they then can become the advocate for themselves and their children. So they know kind of where those inroads are and what those people are and who to talk to and how to talk to them and what to say. Because it's really how our system is ever going to change. So that's how, for me, it relates pretty much in my everyday work, is understanding the structure of what those special education systems are, so that you can then go in and do it yourself differently.
I'm Kristin Duncan. I'm a stay-at-home mom / CNA / I don't know, 2 kids of special needs, and all the parents that don't know how to interact with the system in the waiting rooms drive me nuts. If I could have my own community center just for the kids' parents who didn't know how to run the system, like I feel like I'm the parent always in the therapy room going, do you know you can access this? You know you can access all these things for your kids, and half of them don't know because of intellectual barrier. And plus I had a bachelor's in sociology, so this is really interesting too. But it's pretty much using my background, and it's just so frustrating for the parents who don't know how to interact with the system. So I spend most of my son's in therapy, I spend most of the time reaching out to the parents with the young kids, getting them the access they need.
I'm Carolyn Cornland, and I also work for TriCounty Health Department with HCP, which is a care coordination program for kids with special health care needs. And I'd like to echo everything everybody else has said. That's exactly what we do. We also work with the refugee population, and they come from such a history of oppression. They don't understand any other way of being and don't know how to advocate for themselves at all. So we really work hard to try to help these parents not assimilate to our culture, understand our culture, and help them to do the best they can for their kids and themselves.
Okay, did we?
So we have, it sounds like, several online who are sharing their connection to this work. Probably too many to read out loud.
Okay, I can give like a brief overview. So we have Lisa. Hey, Lisa. I believe this is, Lisa Franklin from Parent to Parent, even though that's not what she said. But yes. Yes, the Medicaid system. Oh, this was from earlier. Oh, yeah, this was way earlier, so sorry. Oh, listen, I don't know what's going on, so let me just step out of it.
Well, so Parent to Parent, they provide support for families of sons and daughters with disabilities and special health care needs. So they try to empower families with the knowledge and support so they can feel engaged with systems to advocate for both their children and for system changes. So you have somebody that's, we have somebody joining us from Kansas, a program manager who's part of a SAMHSA, Kansas Statewide Consumer Network grant with Poetry for Personal Power. And she provides, they provide supports in multivarious ways to their constituency. And the webinar today supports their interest and intent of goals and objectives to increase quality of life. And Karina, you're going to have to help me with the PHQOL, public health quality of life, with disenfranchised populations due to location and lack of accessibility. So we have, you know, public schools are here too, saying that it relates to their work and what they're trying to do.
Yeah. Well, thank you all for sharing. Yep, and someone from Jeffco Health Department. And yes, it definitely does relate to Lactation Project. And especially with, yeah, Spanish speaking, right? We need language justice. And yeah, family and children with special health care needs. So thank you for sharing that, Allison. And I want to, yes.
Can I just share about JFK Partners and one of the reasons why we're so interested in this work is that we are one of 10 sites across the nation, one of 10 states who all of the developmental disability system organizations are working together in a community of practice to look at state policies and practices to embed more health equity and cultural linguistic competence. So we're very interested in this work for that reason also.
Thank you. Thank you. Then we have Suzette, who's a community health navigator at the special care clinic at Children's. So hello. Yeah, so thank you all for sharing, right? And what I heard everyone share. Did you all want to? Good. Okay. Yeah. Oh, is it not?
Hey, my name is Angela Samson from Tanzania. I am here on a fellowship program on inclusive disability. And I see the presentation related to what I am doing on how to support people with disabilities into work, into inclusion, and then how does the policies in Tanzania relate with the policies and the system here in the US. So I am learning on what are the things which are possible to our environment regarding inclusion and the employment policies. Thanks.
Thank you. Are you good? Did you want to?
My name is Amna Ibrahim. Yeah, my name is Amna Ibrahim. I am a diversity fellow with JFK Partners, and also I am a mom of a special needs child who is in the spectrum. We came here for about 3 years, and we don't know about the system and the regulations and the policies here. So I entered this fellowship. I try to understand the US system and reflect to immigrant and refugees populations.
Yes, so we have a ton of people in all different walks of life, right? But the common thread is that we all understand that these systems are not here by mistake, right? And so we all work with populations, whether it's our own families, right, and friends that have to navigate these systems that are very difficult, but they're difficult by design, right? They're not difficult by accident. And so that's what I really want us to keep in our forefront whenever there's an issue that comes up with the family that we may be working with or a friend, right? Especially in doing public health work. it's easy for us to be like, well, why doesn't someone know, right? But folks don't know because they're not supposed to know, right? And that's very deliberate. So thank you all for sharing. Okay. So as a refresher, you know, when we're talking about systems of oppression, right, we want to look at the mistreatment of people, right, in terms of power that do result, oppression has very real results, right? It's not just something that's outside of our being and we just think about oppression and it has no actual tangible results. Oppression is real, it is tangible, right? So we look at people's access to care, people's access to education, people's access to quality food, right? Like all the things that we need in our lives to live and thrive are all part of some sort of a system, right? And these systems of oppression exist to deliberately exclude folks from those, from benefits, right? All right. So let's take a look at some of the systems that we have not yet completely talked about. So how about, okay. So let's take a look at language and images. Do we have any examples of language and images that we use or we see in our everyday life that actually may enforce oppression or reinforce oppression? It's not really, but I'm like, this is, I don't know why it's like, okay. And so, sorry. Does anybody have examples of maybe language or images that we see, whether it's in our communities or on the television, in billboard ads, whatever, that directly uphold these systems of oppression or perpetuate certain stereotypes of communities?
So we have someone online who said white privilege systematically oppresses people of color, institutional oppression.
Yes, thank you for sharing that.
I think a concrete example is a flyer that goes out about engaging parents in education services, and it is a picture of a Latino mother and a Black father. That automatically just gives you that image of those are the people that don't engage, instead of having a wide variety or having no picture at all because nobody really needs it.
Yeah, so there are subtle things that occur, right? Like what images do we use and on what types of flyers or advertisement are they being used? Yeah, so that's great.
So this idea of shared language and what that means in terms of inclusiveness, in terms of how we speak to our refugee and asylee communities versus the refugee and their community, and there's different words that you can use that really include them in our conversations versus exclude them. So I always talk about our refugee and asylee community members versus them or the asylee and refugee community members. But in terms of my personal experience, coming from Mexico, and English was my second language, English immersion programs, what that looks, were traditionally oppressive, and how individuals learning a second language challenged or really paralyzed or limited their growth and how they learn a second language. I was withheld in second grade for not knowing enough English, but at the same time, there were no English immersion or bilingual education programs. So there's a lot of systems within school districts that try to not necessarily force a kid who's trying to learn a second language, even adults as well, it's difficult, and language is a hard barrier to overcome. Many individuals who don't speak the dominant language in English, for example, are embarrassed or afraid or unable to talk because they feel that they're saying something wrong or they're not saying something correctly. So, you know, it's hard for older adults trying to learn a second language, and even kids, they've experienced the same type of embarrassing kind of situations for them. And instead of trying to use that as a disadvantage, a person who has knowledge in their dominant language that is non-English is actually a positive thing, and you should support that and, you know, grow that that particular set of skills. So it's interesting among language. The other piece is what we do at Colorado Access, and I'm not trying to put a shameless plug, but this is a requirement from the state, and it's a great requirement that all of our materials have to be seen by our members who are on Medicaid or Health First Colorado. So any document that we send out has to be reviewed and stamped by a group of members that have volunteered to be part of this. We call it the Member Advisory Committee. So they have to review all of our literature, and we also offer all of our literature in different languages.
Mm-hmm.
And if we don't have that particular language, you know, right now, I think the state requires us to send everything out in English and Spanish, but we know that's not the only languages that people in our communities. 6 languages, thank you. And I think what we do, there's 6 languages, but what we print out is English and Spanish. So everything that we print out initially is just in 2 languages, but there are 6 languages. But if outside of those 6 languages, say there's a specific language like that we don't cover in the 6 general and the 2 English and Spanish, we can provide that language interpretation and materials as well. So
that's awesome.
That's a really cool thing. And it's not just Colorado Access, but any regional organization that supports Medicaid services outside of our region does the same thing. So, but those are just some examples of language system barriers that I've encountered and I'm trying to work with against. Sorry, long answer.
No, it's okay. It's perfect. So if
So Jennifer Online is with Poetry for Personal Power, and she shares, as a peer-centric organization, we face oppression from the medical, in parentheses, clinically, medically necessary, and clinical teams towards the P2P recovery model of care and supports.
Yeah. All right. So I'm like, to recap, for the last 2 people that shared, and thank you so much for sharing. What I gathered, right, or what I understood, and correct me if I'm wrong, is that there can be power, right, or oppressive systems in the way in which we communicate with each other, right? And so, do we use like us versus them language, or do we use like the just us language, right? Like, so our communities, or instead of the communities, or those communities, right? And then we also have the oppression that can occur in educational systems, right? So what forms of knowledge do we uplift and uphold? What narratives do we tell? What language are those narratives in, right? And what does that actually do to people who are then forced to, you know, learn in a certain structure? And then we have, you know, just there could be facing conflict or oppression from medical and clinical institutions, right? Like who actually holds power, right? Whose information is valid, and is your information not valid because it doesn't come from a source that is recognized by these other systems of oppression, right? And so looking at all of that in our day-to-day interactions is very important. So I appreciate all of you all for sharing. All right. So some other systems that we haven't really talked about here, but definitely do affect our communities and ourselves, are governing structures. And so when I think about governing structures, what I'm talking about are courts, right? Politicians or our political system in general, law enforcement, right? What laws are they like really here to enforce? How do they do it? What are the general notions that certain communities are told or receive and are reinforced through interactions with law enforcement, right? State and local departments, whether that's a health department. I often struggle with this myself working at a state health department, which can be seen because we do interact with communities and we do create a lot of programs that are can affect negatively and positively our communities, right? And so how then do we check ourselves when we know that the work that we're doing is also tied up in this system, right? And then economics. We often don't think about the economy and how money, really affects our communities until we're facing that, right? Like when it comes down to somebody that we know that can't pay their rent, or somebody that's being pushed out of their house due to gentrification, or the family next door that can't afford to buy fresh fruits and vegetables or can't travel to the store to get fresh fruits and vegetables. It's like something that we have to kind of visibly see, or when it's time for us to pay rent, ooh, do we have it or not, right? But our economic structures are always in the background working. And even in the ways in which, whether we're state, local, or local health departments or community-based organizations, right? How do we fund each other? How do we fund those organizations? Do we really give as much funding as we can to community-based organizations that are doing the work, or local public health agencies that are doing the work? Or do we just go with the same old, right? And what we know is that if something is predictable, we probably shouldn't be doing it, right? If something is predictable, 9 times out of 10, it's oppressive, right? Because we haven't lived in a world where that has been oppression-free, right? We haven't lived in a world that has yet seen equity. And so if there's something that is our mundane and we do every day, that's probably something we should be questioning, right? The innovation comes in the things that we like are uncomfortable doing, right? Because we've never done them and they're a challenge. And then we've hit on this too, education, our education system. And then language and images, which we just talked about. So what does this mean for the work that we do? This means that we just need to ask more questions, right? There's no key to equity work, right? I wish I could sit here and give you the keys and say, if you just did X, Y, and Z, the world would be a better place. But the fact is that we've never lived in an equitable world, right? Like, I don't know what that looks like. We don't know what that looks like. Our parents and grandparents and great-grandparents didn't know what that looked like. Right. So there's no blueprint for this that currently exists anyways. There might have been, but not there anymore, right? And so all that we can do is make sure that we're asking more questions. And so in terms of questions that we can ask ourselves, right, when we're interacting with our communities or making policies or maybe even putting out a new grant, we need to ask ourselves about our feelings, right? Because our feelings are facts. Our feelings are facts. So if you're putting out something into our communities and you don't feel like you should be putting it out, for some reason, even if you can't quite name it, it doesn't sit well with you, you might want to refrain from putting that out into our communities. And then think about your thoughts, right? So what are my thoughts about X community, right? And are they upholding my truths? We all have our own lived experience and we operate from that lived experience. But just because that's our lived experience doesn't mean that it's a fact for everyone else, right? And so are my thoughts and beliefs accurate? 9 times out of 10, we're gonna say yes, that's why we need to get a second opinion, right? An opinion from someone that doesn't look like us, right? And that we most likely, hold different identities from. Challenging our notions of good and bad, right? And success and failure. I think that a lot of times in work in general, right, we think that, well, I don't want to work with so-and-so because all their things fail. Like we don't want to, or I don't want to, this neighborhood's not really like, they're kind of a bad neighborhood, So we want to challenge our preconceived notions of that because it's not by mistake that we put those quantifiers on certain communities or on certain programs or public health departments or what have you, or community-based organizations. It's all by design, right? Someone told us what bad is, what good is in a certain context, right? Or what success and failure looks like. And then think about really in what spaces and when you're surrounded by whom do you feel the most comfortable, right? Be honest about that, because that will tell you in the space, that will let you know directly the spaces and places, right, that you're actually not comfortable. And what you should do is try to stretch yourself to go to those spaces, right? We want to get out of our comfort zones because comfortable is safe and safe is dangerous, right? Like that's a dangerous space to be in. And then there are questions that we can ask in our work, right? So have we sought input from historically marginalized populations? And historically marginalized populations might look different to each organization, right? Just depending on what your population is. What groups might be harmed, right? And literally write out a list of what groups and communities might be harmed, how they might be harmed, and why, right? And if there's any harm that can occur, we need to rethink that policy or that action before we follow through with it. We need to think about, are there other ways that a project or program can be done, right? Like I said, being comfortable is dangerous. Doing things the same way that we've always done them is oppressive, right? Like if we want to continue, we live in an oppressive society. So the same ways that we've been doing things are pretty much letting us know that that's not the right way to do things. And so think about other ways we can implement programs and projects. What policies do we have at our community-based organizations or at our local public health agencies or public health agencies that support inclusion? And again, we're not talking about inclusion, I have a community cafe and communities open to come in. We're talking about spaces and where communities are actually utilizing, right? So like I have a community forum and we had at least 30% of our community show up to the forum. And they all talked, right? They all utilized that platform in that space. And then again, where on the community engagement continuum is my work? And I'll show the community engagement continuum in a couple slides. All right, so ways to move towards balance. We always want to get not even a second opinion, right? Because the second opinion is probably going to be from someone that looks like us. So the third opinion, always get the third opinion, the opinion from someone that holds different identities, right, than you. Get out of our silos. I know silos is a very public health word, so just get out of our own bubbles, right? Constantly check in with your emotions, because again, feelings are facts. Make connections with our community members. Take training further, right? So we don't want to just stop at this webinar or a webinar that might be happening next week, but we need to look at our actions, right? So our action plans, the things that we do in our work, right? How we grant, how we write grants, who can actually apply for our grants, what is our funding streams and our funding structures, right? And then ask questions. A great example is this is at the state public health department. In the MCH program, we thought we always wanted a youth advisor program or committee, and we were told that we couldn't do it, that like you have to have a degree to work at the public health department, and you have to be over 18, right? But people push back on that, right? And they ask questions like, who says that you have to be 18? Who said that you have to have a degree? Is that true? And upon doing the research, found out that like none of that was true. None of that was true. Even though it was coming from our human resource department, it wasn't true, right? And that it was just the way that we've always done things. We just historically didn't hire people that were under 18. We historically didn't hire people that didn't have a degree, right? But that wasn't actually a policy. And so now we have a youth advisory board and we pay them, right? They're employees and they're paid for their time. And then also share power with those who you may not have historically, may have not historically shared. And because we're short on time, so we do have some resources at the Public Health Department. We have created this Colorado Youth Engagement Continuum. And so as you move towards, I guess, viewing it, you're right viewing it, we get more towards partnership, right? But everywhere on the continuum is valid. So if you're on the left side and you're working with just like you're doing participation, you're doing outreach, and you're consulting the community, that's just as valid as having partnership, right? Our hope is that eventually our programs will start to shift when we can and where we can to move towards partnership. But everything on this continuum is valid. In the middle, we have engagement. So we have involving community, right? Involving our community. So if we go and say we have a flyer and we take it to our community and they say, no, I don't really like that. I think you should change X, Y, and Z. We then go back and change it and present it back to the community, right? And we keep doing that back and forth, that flow, until we get the go ahead to put our materials out. And this says youth, but it's like really can just be used for community in general, community engagement. Collaboration means that our community can influence the decision, right? So our community can say, I really don't want you to put this out. The tricky thing about collaboration is that organizations can still choose to put it out, right? And so that's the difference between collaboration versus shared leadership. Shared leadership is when, like, the advisory board that has to give their stamp of approval before anything goes out, right? When there's that power sharing. When if a community actually says no, like, it does not happen, which is like the ultimate kind of partnership that we want to get with communities. We also do have the Family Leadership Training Institute in Colorado, FLTI. So it is a nonpartisan training institute. It's housed at the CSU Office of Engagement. And it is a 20-week course, right? Participants do not have to pay for this course. So it's free. So, you know, it costs the FLTI program about $2,500 for the course per person, but participants do not have to pay. And it recognizes communities' inherent power, right? So it's literally the community members create their own community project within this 20-week course, and it can be on anything that they see is maybe a possible issue in their community and provide a solution for that. And it does center civic engagement. And so they talk a lot about policy, laws. They have a day at the Capitol. And yeah, so it's a very interactive course. If you all can see, I'm not sure, I can barely see. There's about 12 active sites throughout Colorado right now for FLTI. And so we do have 2-gen sites as well. So it's 2-generation means that there's a youth and an adult program. And so, yeah, and we have that in Denver, Larimer, and Jefferson for the 2-generation. All right, other resources, and these are also linked on the page. The De Beaumont Foundation has a great tool that I think that folks should use. And so it's building skills for a more strategic public health workforce. What it looks at is 8 strategic skills, right? There's like diversity and inclusion, there's persuasive communication, there's strategic mapping, right? So it lists out those 8 skills in the ways in which we can use them in our workforce to really make sure that we are being innovative in our work. There's a diversity toolkit from USC that I thought was really great, and it's good for people who might not be comfortable having these conversations just yet, but want to learn more about power, privilege, and inclusion. And then we have the National Family Support Network. I actually train staff on this tool or let staff know about this tool as part of my training at the state. And so this is called, they have standards of quality for family strengthening and support. They've come up with 5 different standards or 5 different areas, right, that are like the primary areas that families need support in or areas that need to be strengthened in. And, and then they also come up with the indicators. And this is a great tool if you're looking at maybe action planning, if you're looking at trying to have measures for community engagement, because those can always be tricky. That is a great tool for that. And then folks in the room got the handout on the diversity and inclusion language versus social, like justice and equity language. And then I will make sure to get that put online for folks that are on Zoom. But that handout is great because it talks about like, let me see. Thank you. Sorry. Okay, so a good example of like the language that's on the justice and equity handout is like, for example, it says diversity asks who's in the room, equity responds who is trying to get in the room but can't, whose presence in the room is under constant threat of erasure, right? Inclusion asks, have everyone's ideas been heard? Justice responds, whose ideas won't be taken seriously because they aren't the majority, right? And so really digging deeper and asking deeper questions to get at the heart of these systemic issues and problems, right? And so with that, it's open for questions and discussion. I know this was just like laying the foundation. So if anyone has any specific questions or any specific things they want to talk about, this is the time, because we still have time, right? Yeah, we still have 30 minutes for a question and answer. So.
Well, Vicki says that she loves this because she believes that we do need to be purposeful about how we work and who is sitting at the table with us.
Yeah, thank you, Vicki.
You're welcome.
Oh, and in the resources too, I believe should be on the page are those same questions in another form. And then I think that also has a few other questions on the actual PDF. All right.
Well, you've given, I think, people some really great strategies on where to start, which I think is sometimes hard to figure out. So we appreciate your presentation, and everybody help me in thanking Angel for coming today.
Thanks. No, thank y'all. Y'all help.
Thank you, Angel.
So we're going to be sending out an evaluation to get your feedback and also to get more ideas for future MCH webinars. And in that evaluation, you can request a contact hour certificate if you would like it. Okay. So thanks so much.
Thank you.